Okay, so now we want to explore why a TMJ problem can be painful. We know a good number of people that the pain of their joints keeps them up at night or prevents them from having normal function, and they cannot talk, they can't eat. So let's go to the CT scan so that I can explain that. If you remember earlier, I said this condyle of the lower jaw is suspended from this fossa, from the temporal bone, by a capsule. Inside that capsule, there is a disc that moves with this condyle forward. The disc, by nature, is very, very low in vascularity. The vascularity that it gets is usually from the tissues on the back of the disc, called retrodiscal tissues. Retro means back, discal tissues. If this disc slips forward and stays there, the tissues that are at the end of the disc and are very sensitive, they get stretched over this. And then when this condyle moves up a little bit, it'll put pressure on those tissues. And that's where the pain comes from. The capsule itself cannot sense pain. The front part of the disc is made not to sense pain because, for normal function, we are putting pressure on on the center of the disc and front of the disc because the condyle is pushing the disc forward this way. But the back of the disc, nature did not design this to withstand any pressure, therefore it channeled all the vascularity and the nerve endings through that. So if there is very little space back of it and the disc has moved forward, that's when it becomes a painful situation. This is a healthy person. If you see, the condyle is suspended from the fossa, and there's almost equal distance space between the condyle. That means the disc is kind of healthy situated here, and there's less space here. That's normal. Now, if this part of the condyle was touching this, that would be a very, very painful TMJ situation. Again, on the other side, kind of healthy. See? Equal space there. This is what you want to see. So, if this disc has moved forward and the condyle is putting pressure on the tissues here, then it becomes a very painful situation. And that's when people have TMJ pain. Now, you may ask, what is the treatment for TMJ? The detailed answer to that question is way beyond this video. But I can give you an answer that satisfies 99.9% of the people with TMJ problem. 99.9% of the cases are treated with a splint. A splint is a night guard which has certain features embedded in it to take advantage of the natural physiological feedbacks which exist on the teeth to minimize the pressure on the TMJ and to give negative feedback for the muscles of mastication to relax when the person actually starts to grind the teeth. So we can go back to this question of what is the treatment for TMJ? I would say 99.9% is a splint. Now, splint itself has several types of splint. We're talking about repositioning splint most of the time. Now, there are other types of splint that only very few skilled clinicians can diagnose their necessity and actually fabricate it. And those are anterior repositioning splints, and that's when the pressure is on the tissues here. Patient is very painful, so the splint has to be made in a certain way for the pressure to get relieved from back of this tissue, back of the condyle, and then little by little to move it back to normal. Again, that is beyond the scope of this video, but what is important is 99.9% of the people, when they have TMJ problem, the best thing they can do for themselves is to get a splint. You may say, what if I just get a night guard? See, a night guard is a piece of plastic which was made for to be worn either on the top or bottom teeth, and for and anything that you place between your teeth will break the cycle of grinding, and it will help with the grinding. But long term, if you wear something that does not have those features that take advantage of the physiologic feedbacks which are put in the teeth, that will stop being useful because your body will adapt to those irregularities, and you'll still grind, you'll just grind on the night guard, and it doesn't reduce the intensity of your grinding. It will just wear the night guard instead of wearing your teeth down. So if you're going to get some protection for your joint and teeth, get a splint. It's definitely about 2 to 3 times more expensive than a night guard, and it takes time to adjust it properly and deliver it clinically. But it definitely is a better long-term solution for your TMJ, and it's a definite better prevention for TMJ disease than just a night guard.